So today we will learn neuromuscular disorder, Alzheimer's or Alzheimer's disease. Alzheimer's disease or AD is progressive neurodegenerative disorder characterized by loss of memory, conjunctive decline and behavioral changes. It is the most common cause of dementia in older adults. Causes are genetic factors like mutation of APP amyloid precursor protein PSEN1 and PSEN2G, ApoE4 allied increased risk, age-related factors, risk factor after 65 years, environmental factor, head trauma, lifestyle toxins, metabolic, vascular factor, diabetic, hypertension, oxidative stress, pathophysiology, progressive loss of neurons, especially in hippocampus and cerebral cortex, accumulation of abnormal protein, amyloid beta plaques, extracellular deposit disturbing neuron communication, neurofibrillary tangles, tau protein aggressive inside neurons causing cell death, leads to brain atrophy, synapse loss, and impaired neurotransmission, particularly acetylcholine. Clinical features or symptoms: memory loss, disorientation, language difficulties, difficulty in daily activities, behavior changes, loss of judgment and reasoning, progressive decline, like especially like memory loss, especially in recent events. Patient will not be able to remember what they have done in recently. Disorientation, patient will not remember the time, what time is it, what place the patient is, who is the person who's standing in front of them, loved ones, he'll not recognize who he is talking to. Patient will always have some language difficulties in speaking and like daily activity, dressing, cooking, tying shoelaces, buttoning up. Patient will be agitated, he'll suffer with anxiety, sometimes maybe depression, and eventually it will be like eventually total dependence on the other person. Diagnosis: for this diagnosis, clinical history, conjunctive test, mini mental state examination, clock drawing test, imaging such as MRI, CT scan, cerebral atrophy in large ventricles will be seen. Some biomarkers can be tested: CSF, amyloid beta, tau protein levels. Genetic testing is also available for early onset and in these cases treatments, some drugs are there: gabapentin, mematine, antidepressant, antipsychosis for depression. Non-pharmacological treatments are conjunctive therapy, memory exercise, routine environmental support, social interaction, and physical activity. Sometimes the complications can be total loss of independence, very aggressive patient, and a very immobile patient, sometimes infection and nutrition deficiencies. Thank you.